Excellent. Okay, it looks like the webinar has started. Welcome, everybody. I'm Virginia. I'm the head of product at Lyrebird Health. We've had a surprising number of registrations, and we're super excited to talk tonight about mastering the CDM to CCM transition. And I'm also thrilled that Dr. Sean Stevens is joining us. He's obviously an expert GP and has been one of our main collaborators as we've been developing some of our product features that will support GPs with CCMs. Yeah, very excited to have him here to talk a bit more about how it all works. Just a couple of little housekeeping things. We're not going to have the chat on for this webinar because it can be a little bit distracting, but you can use the Q&A feature to ask questions and upvote questions. And at the end of the webinar, we will answer as many of them as we feel like we have time for. And then we'll follow up afterwards with the answers to more of the questions if we think it's going to be helpful, and we'll update our website with frequently asked questions as well. So do ask as many questions as you have, and we will answer as many of them as we can during the process of the chat. Next slide, please, Sean. So I would like to acknowledge the traditional owners of the lands on which we meet today and pay our respects to their elders, past and present. We also acknowledge any Aboriginal and Torres Strait Islander people who are with us today. Thank you, Sean. Okay, so in today's session, Sean is going to talk about what the changes that have come in with the chronic disease management plans and how those changes affect GPs and your practice. And obviously you've been doing this for nearly a couple of weeks already, so we're not going to spend too much time there, but just really, frame up the challenges that we are seeing in the industry. And then we'll talk about how Lyrebird can support you to deliver those care plans sustainably in your practices and show off a bit of a product demo. And then we'll make time for some questions. I might hand it over to you, Sean.
Great. Yeah, thanks, Virginia. It's always good to get some CPD points when you're spending time learning stuff. So we've done up a SelfLog form. It's all pre-filled. So if you want to scan the QR code, we'll also send it out with the email and get your CPD points for attending this webinar. Now, look, we've been doing the CCM now for 9 days, so people are starting to get their head around it. There's a number of, it's not all bad news. Obviously, the rebate has gone down for a new plan, but a lot more people are eligible. So it means that what you need to do is you need to find efficiencies in the system. The new plans, they don't need the TCA referral forms, the EPCs. You don't need to get the communication back from the allied health people. So it makes it much less paperwork. And also the advice is that a lot more people are eligible. So previously the feedback we got from the department was about 20 to 30% of our patients were eligible for care plans. Because it was complex and chronic diseases. Now it's just chronic conditions. And so that means between some people, well, the advice that Michael Wright, our president, has had speaking with the department is it's about 60% of people are eligible. The challenge we have is that to try and fit that in, because if we look at the rebate is really not much more than a standard long consult. So if you're spending 30 minutes in a private billing practice, that is, if you're spending 30 minutes doing a care plan, then really, financially, it doesn't account for all the extra resources and stuff that have to go into with nurse time, etc. So we need to find the efficiencies in and around that. The other thing is to make sure there's nothing worse than starting a care plan and then finding it gets rejected and you've put a lot of time and effort into it. So I think it's very important to identify patients that are eligible and make sure you're not putting all the time and effort into patients who are not eligible for a care plan. They've had it done elsewhere or you're a couple of days short and so forth. So we've got some advice on how we can help with that. It means more patients are going to be eligible to be able to get the 5 visits to allied health. And again, all you need is a standard referral letter, which is great. So people will need to adapt to be able to keep it sustainable. Having spoken to, so our practice works with Scale by Clinic, who crunched the numbers on this, and really you need to be able to either what they're proposing is either having a nurse do the plan, and then the doctor just pokes their head in, or a doctor does it as part of a standard consultation, or you have a 15-minute nurse appointment and a 15-minute doctor appointment. And there are ways that you can get using artificial intelligence to be able to generate these plans and make sure that they're generated properly in a time frame that's workable within the resources and constraints that we've got in front of us. All right, I might just hand back to Virginia.
Right. Okay. Thanks, Sean. So we're going to show a video, pre-recorded video of the product demo, just because, demos can be a little bit spicy. This was recorded today. It's the product as it exists in, live now. So there's no funny business. It is the live product. And you might need to turn your sound up a little bit to hear the audio, because we found it a little bit faint when we were testing. But yeah, jump in and click the play button, Sean. Are we hearing that now? It sounds like maybe only Sean can hear the audio for this. I'll live commentate it. Okay, so what we can see here on the video is we're starting this consult, and we're about to show you this new feature called the patient summary, so this is really cool. What we're doing here is we are pulling data from the patient record in best practice and summarizing it. So this is cool not only because we can give you a summary of the patient's medical history and medications and allergies, but also because we can use this as context for the development of the actual plan. So instead of needing to verbalize this through the process in order for Lyrebird to be able to use it, it's already there in context. It has the complete medical history, so it will be able to incorporate other conditions into the development of the care plan. And it's a new feature that is available not just with care plans, but with all consults for integrated best practice users. So really like neat extra details that will help make your consult notes much stronger. What we're going to do now is kick off the chronic condition management plan. So you can see we've selected that and brought up the conversation guide. So the conversation guide, most GPs are super familiar with putting together these plans, but this just gives you a little reminder of the points that you are going to need to cover off during your consult in order to be able to complete the plan at the end. And so what I've done, instead of making you endure 5 minutes of me talking to Margaret, the patient, I sort of pause the recording, and then in a second I'm going to jump back in and stop the consult, and then you'll see the plan generating. Okay, so that's happening now. So you can see here on the left-hand side, we've got the standard Lyrebird consult note that's been generated, and then in the right-hand pane, you can see that we are generating the complete chronic condition management plan. So scrolling down here, you can see that it's capturing kind of all of the basic detail about the patient, and you can edit anything or fill out any fields that are empty. So scrolling down, we see the the medications and the allergies, and so on. But then in a second, we'll get to the good bit, which is the automatic generation of the actual plan. So you can see here coming up the management plan, which outlines the patient problems and relevant conditions. So you can see that that's picked up, these are things that were not articulated in the consult. They came from the patient summary in best practice. We've put together the goals, so specific goals that have been discussed with this patient about their blood pressure and their weight, and as we scroll down, you can see that there are, treatments and services suggested for a full range of conditions. And then we generate a set of referrals that are relevant for this plan as well. So not every plan will come out fully formed, but we think this is going to get you 90%, 95% of the way there, so that then it's really, really easy to jump in, make a few amendments, and then save this document to best practice, where you will be able to add in your letterhead and make some more make more adjustments if you need to. So you can see here that we've saved the document back to best practice. And I'll jump into correspondence out here. And then you can see, I'm going to double click on this management plan. You can see that it's automatically generated a doc, editable doc, fully editable. You can add your macros and your snippets and your letterhead and all of that kind of stuff right from within best practice, as you're used to. So that is the completed management plan. A little bit of a surprise to be live commentating it, a little bit uncomfortable, but having performed the demo many times this afternoon in preparation, I felt like I was well equipped for that in the end. Sean.
Great. Yeah, thanks, Virginia. Handled that very well. It was funny hearing you twice in hearing you in my pods from both sides. I think one of the key things with this is that you've got in the live, when it's live and you've got a patient in front of you, before you even kick off with the CCM, you are able to check that they're eligible. So using a Cubico integration, and the important thing about the Cubico integration is it's the only one that checks with Proda. So even if it's been done elsewhere, there are a number of other services that will check the billing within the practice, but Cubico is the only one that has got that Proda integration. So being able to integrate with that means that you're able to ensure before you even kick off that the patient's eligible. Then you can do it in pretty much as you saw in real time. The other way, if you're going to utilize the nurse to do it, if you get a nurse subscription for Lyrebird, then you can then you can get the nurse to do the document, and it will end up in the patient outbox and be editable by the doctor. So the nurse can do it before the doctor sees the patient. So that's certainly another option as far as making sure that it's time efficient. Yeah.
Maybe, Sean, I can jump in here and just talk about some of the things that are coming soon. So I think as you will have seen in the demo, and definitely I can see in some of the questions that people are already using the feature. So we're sort of in preview mode at the moment. We feel like the product certainly is going to help you generate those plans really, really efficiently. But there's definitely work to do to make sure that we adapt it to the kind of real world experience of people generating plans. It's all very, very new. So there are a couple of things that are on the roadmap that are coming soon. The first one that we're really trying to get to is we'd love you to be able to produce a final document with letterhead and all of the information straight out of Lyrebird. So we will be making lots of improvements along the way just to further streamline that process. The next thing is kind of deeper coverage of goals and actions for a wider range of chronic conditions. We currently draw from the Australian guidelines about care plan goals and actions, and that informs the plan that is generated. But as more and more people use the plans and we get to understand kind of what are the core goals and actions that are relevant, we will be able to start to expand the product. And then finally, like the CCM is an important workflow that everybody is doing repeatedly every day, but there are a bunch more that we want to apply this process to. So more care plans and health assessments are also on our roadmap, and then a bunch of other little tweaks and fixes as the product gets used and we learn more from you all. And just a note, like you can see on the screen, the red circle around the little feedback button. If you're using the product and running care plans, we would absolutely love to get feedback from you about any aspect of the experience. We're really, really aiming to get this product, we really want to make it so that it just takes you, a minute to generate a care plan, and just reduce the friction as much as possible. So feedback of all kinds is really, really welcome. So thank you if you can do that for us.
Great.
Cool. Also, the Lyrebird Health website has a resource hub with some more information about the care plans and the feature, which you can jump onto at any time. And we will update this page with any questions that come out tonight that we think are really important to answer or relevant to a wide range of people. So please jump on there. You can use the QR code to get to that, or just jump onto the Lyrebird website. Cool. And I think we might be ready for some Q&A now. So Sean, did you have anything to add?
Yeah, I might just stop sharing screen if that's okay, so I can see all the questions and stuff.
Yeah.
I apologize to people who are going to have to be staring at my face or our faces.
It's all good.
All right. So I believe one of the questions is around signing the document. So there's a couple of ways you can do that. One of the ways we do that in our practice is to have the signature in a different font. So we use Rage Italic, and we have the doctor's name just appear as a shortcut. And for each of the doctors, your initials. So for me, .ss, and it comes out Sean Stevens in a very different sort of like a running writing style font. And we haven't had any issues with that. And then that's still saved as an RTF. I know some people feel happier with printing and signing and then rescanning. I think that's quite a bit of double handling. But those are the sort of ways that people work around it.
Yeah, great, Sean. I might jump in and answer a couple of the other questions about the product, and then I can see in here that there are a couple of questions about the CCM as well that you will be more equipped to answer than I am. So the first question was, when will Lyrebird add the option to have a context box pre-filled with information from previous consults? Thank you for that one, Adam. So as you can see, that we've already just introduced the patient summary, which is injecting a bunch of the most important historical information from consults. And so that is going to cover a large amount of this need. And the other thing that we're currently working on is the ability to inject to run your CCM reviews as well through Lyrebird. And that will capture your historical review, like your historical care plans, and use them to help generate the future notes and care plans or care plan reviews. And there are undoubtedly more things that we can do there, but those things are definitely coming soon. And then the other one, I think our anonymous attendee has asked about the sequence to save the plan, as they've noticed that if they press stop and then stop consult, the plan is not generated. I think we've got a bit of a UX, like user experience glitch there, a design glitch that we've just released a fix for. It's just like we've put a button that is a bit misleading about what it does. And so that should be fixed in the coming days. Just stopping the consult without touching that other stop button should help you generate the plan. And apologies for the mess there, but I think we will fix that in a release that's coming out in the next couple of days. Sean, shall I hand over to you? There's a question about the item number, the amount of time required to claim, and also who might be eligible for the CCMs.
Yeah, so there's no minimum time requirement for CCM. So that's why the nurse can do it, and then the doctor, just does the quick bit that they need to do, and that's still eligible to be claimed as a CCM. So no minimum time. Getting people back for other appointments and other things that are time-based, that's, you may want that maybe when you do some of your more detailed, clinical stuff. Yeah. And sorry, was there a second part to that question?
There was another question about, let me see, the one by Mun Yung. Did you see that one?
No.
Let me see. I'm going to put it in. I'll put it in our chat so that you can see that. Answer that.
Yep. Okay. There are many patients with back pain for years, but no definite diagnosis. Yes, they are eligible for a GP CCM. This is where CDM is different to CCM. So chronic pain, if you look at the descriptors and the stuff that the department has sent out, it's any condition that has been present for 6 months or terminal or is likely to be present for 6 months. So that's why they think there's such a broad remit of people. So back pain definitely would fit, as long as it's been there 6 months or likely to be there for 6 months.
Thanks, Sean. We have a couple of questions in here about why the saved plan from Lyrebird not showing up in correspondence out. So we're aware of that. The correspondence out window needs to be refreshed. You can do that quickly pressing F5. And we are talking to best practice about whether we can trigger that refresh automatically so that you don't have to do that yourself. Thank you for calling that one out. We have noticed that one in a couple of spots.
Yeah. That caught me out the first time too with it's the same with the mental health care plan there. You think, where to go? But yeah, if you just press F5, then there it is. Yeah.
Yeah, great. And a couple of people have asked questions about review and reminders. So review, we will have a solution to reviews in the product by the time the 3-month mark arrives. So we know that the reviews will start happening in 3 months. We want to make sure that those can be run through Lyrebird as well with the context of the previous care plan. So we're working on that at the moment. And as for reminders, I think we're definitely very interested in being able to automatically generate the kind of reminder, like the reminder directly out of the consult, and we're just exploring ways to do that. Not sure when we'll have a solution for that, but it's definitely on our radar. Let me see. Judy has asked about integrating Lyrebird with medical director. So that is not something that we are doing at the moment or able to do at the moment. But again, it's on our list of things to consider in the future. So thank you for that question. This feature is only currently available to integrated best practice users, but we definitely want to make it more broadly available in the future. Sean, let me see. Are there more obvious Sean questions in here? Let's have a look. So we have a question about integrating with best practice if there is, if they use a VPN to log into the server. That is one that actually came up today. We are not sure about the answer to that yet, but that is definitely something that we are aware of being tricky at the moment. And you could reach out to our support team and log a request there, because then when we fix it or figure out a way around it, we'll be able to get back to you and let you know what's happening with that one. Let me see. Let me have a look. I'm just looking for more questions to answer here. So we've got one person who says that they have successfully used Lyrebird with a VPN. So that sounds promising. And I think we've almost covered all of the questions. We can definitely go through and make sure that we've captured answers to all of these, and we'll share out any answers that we've missed in the chat. But I think we've probably covered the bulk of them. Actually, go on, Sean, if you spot.
There's one, and it's been upvoted once.
Yep.
In the new CCM model, how do we stipulate how many sessions are allocated out of the 5 to each of the different allied health providers? The answer is we don't. It's up to the patient to sort that out. The department's advice was, look, patients are autonomous people. It's up to them. If you do them a referral to a podiatrist and a diabetes educator, and they do 5 visits to the podiatrist, well, that's their 5 visits. That's no longer our responsibility, and we don't have to send new letters and forms, and you don't have to, although it's often a good idea, you don't have to specify how many visits on the referral letter.
Thanks, Sean. I can see a question here from James. Is it possible to run a 965 and a mental health care plan simultaneously? New changes suggest we can't build together, but sometimes it's unclear which way it will go in the actual consult. So we are aware that generating the plan might be a decision that you actually want to make later in the process, like after the consult has been completed or late into the consult conversation. And so we're looking at ways to make that available. And once we do that, you will be able to generate any kind of care plan based on the consult. You just won't get the benefit of the conversation guide, but I think most of you will be able to survive without that. And then the other question there that was a good one was, why not have the PHX data for BP always utilized to do Lyrebird notes rather than having to click on another tab? The answer to that is the data is always going to be utilized. You don't have to click on the tab in order for that data to be utilized. It's just there as a reference point for you, so that if you want to quickly grab some information about, medications, past history, etc., about your patient while you're in the consult, it's there neatly summarized, rather than having to jump back into BP and sort of click around in a bunch of places. So that is something, and I think there's lots more we can do there to make that super clear too. All right. Couple of questions about the roadmap. One is there any likelihood of Lyrebird coming up with an AI program that will handle medical reception that can integrate with best practice? It's not something we're currently working on, but we definitely see a lot of people talking about AI reception at the moment. Never say never, but not on the roadmap for now. And we have a question from Jacques. What is the cost of the nurse Lyrebird subscription? So it's 50% of the cost that a GP pays. So it's really, it should be quite accessible for the practice nurses. Let me see. I think we are getting to.
There's a question there. Is there an option to add specialist names when writing referral letters, etc.? So from Niket.
Yep, I see that one. So we can't do that yet, but currently you'll have to do that by editing the plan in best practice to add from your best practice address book. There's a question about how do I use Cubico to check Proda for eligibility. So Cubico should be doing that automatically for you. I think there is a daily process that you have to do in your practice to make sure that you have the latest Proda eligibility for your consults for the day. But Cubico definitely handles that. It's a really good feature. And the cool thing is that it also feeds through to Lyrebird, so that when you're kicking off the consult, you will get you'll get a big banner that says that this person is eligible for a mental health care plan, or for a health assessment, or for a CCMP. So that Cubico is like super good product to use, so that you get that information. Robert asks, when I now do a GP CCP, does all the allied health info automatically get generated, so I no longer need to write a separate letter to each one? This is a good question. So I think that is maybe a feature that our one of our team members is working on at the moment, is the ability to automatically generate all of the correspondence, like the referral letters that you need for your allied health folks. Sean, jump in if you think I'm not answering that question correctly, because there may be stuff that I'm not following there.
No, I think that's it. I think as part of it, as I understand it, the roadmap is looking. So you're talking about a CCM. It does the document, and coming will be where it does the referral to the non-GP specialist or the allied health person, as part of doing that process. Not here yet, but working on it. I think that answers the question. I think.
Yeah. Yep. Great. Thanks, Sean. I think that feature should be coming pretty soon. So looking forward to having that.
I've got one from Austin. Hi, Austin. Patient requested that the CCMP be uploaded to My Health Record. Is this possible? If so, how? The answer is yes. It's a bit clunky, not because of Lyrebird or BP, but just the integration with the My Health Record. So you can do it as an event summary in the My Health Record. But it's not a very well formatted document. I haven't done it with the CCMP, but I've done it with other documents, and it doesn't look very pretty, I've got to say.
Great. Ursa asks, can I bill 967 now on a patient who had GPMP in October 2024? I think the answer to that is no, but Sean, I think you have to create a new CCMP at this point.
Yeah, so what needs to happen is, if they're due for a review of their 721, 723, then you do a new CCM, so item number 965, and then in 3 months' time you do a review. I can't remember that item number, but you do a review, and the rebate is the same as for the original CCM. So yeah, the reason the department has set it up this way is they want to try and encourage us to review our patients more regularly, rather than just having a high rebate to do the plan. And most plans, the vast majority of plans, were actually not getting reviewed. And we were doing the work. We weren't just that we weren't billing the number. But anyway, you can't convince people unless you see the figures. So
excellent.
Yeah.
Okay, I think we'll take this one more question that I will take, and then I think I'll wrap us up here. So we have a question from Imran. Is there a way of getting involved in co-design of new feature development and testing as a GP? Imran, I would love that. So my email address is virginia@lyrebirdhealth.com. If you or anybody else on this call is interested in being involved in sort of user testing, customer testing, co-design, we really love to engage the GP community, and our engineers really love it as well. So please feel free to reach out, and I'll get back to you really soon.
Can,
Okay.
can I just, sorry, just before we do wrap up, Najwa's actually raised a very important point. Can more than one nurse utilise the practice, utilise the nurse allocated Lyrebird subscription? Now, I'm not a technical person, but if they're logging in, if they have like a chronic disease nurse login, they could all use that one login in BP. They could all then use the Lyrebird subscription. Is that
They
correct?
they could. It would be against our terms of service in theory. So our terms of service are one license, one person. But I imagine that it would work. You could try it out and see what happens, and I would look the other way until such time as we make that more difficult to do.
Okay.
Okay. Thank you. Thank you so much for all the great questions, and we will follow up with answers to anything that we've missed, and try and summarize some of this stuff into a doc tomorrow. So thank you so much for your time and participation. And Sean, thank you so much for your collaboration as we've been working on the feature, and your participation in this webinar. It's just been so great getting to know you and your work and working with you on this stuff. So thank you, and thank you everybody for attending.
Great. No, it's been a real pleasure. Thanks, Virginia.
Great.
Thanks, everyone.
Thanks, everyone.